In this clinical overview, we present a physician-endorsed nighttime beverage designed to simultaneously enhance sleep quality and stimulate nocturnal metabolism for targeted adipose reduction. By leveraging evidence-based botanicals and nutraceuticals each with specific pharmacodynamic properties, we aim to optimize hormonal, enzymatic, and microbial pathways that contribute to fat oxidation, glycemic control, and restorative sleep architecture. 1. Chamomile, infusion, and sleep physiology. Upon steeping 1 tea bag in 240 to 360 milliliters of water at 90 degrees Celsius for 10 to 15 minutes, sufficient concentrations of volatile oils by enhancing SWS proportion and minimizing sleep fragmentation. Chamomile infusion, indirectly, augments nocturnal fat mobilization. Studies demonstrate a 20% increase in SWS duration with regular chamomile use over 2 weeks, accompanied by lower nocturnal cortisol peaks, reducing catabolic stress responses that would otherwise inhibit lipase, and flavonoids are extracted to achieve plasma associated with decreased sleep latency and improved sleep efficiency. Clinically, apigenin's half-life of approximately 6 hours aligns well with nocturnal dosing, supporting sustained GABAergic tone through the first 2 sleep cycles. Chamomile is widely recognized in phytotherapy for its anxiolytic and myorelaxant effects, mediated primarily by apigenina flavonoid that binds to central benzodiazepine receptors, exerting mild GABAergic action. Rapid eye movement and slow-wave sleep are crucial for metabolic homeostasis. SWS promotes growth hormone secretion, which facilitates lipolysis via hormone-sensitive lipase activation in clinical application and timing. Dose: 1 tea bag in 240 to 360 milliliters water. Steeping: 10 to 15 minutes at 90 degrees Celsius. This citrate shuttle effect promotes fatty acid flux into mitochondria during sleep, when exogenous glucose availability is low, supporting extracellular matrix integrity in adipose and vascular tissues, which can indirectly improve microcirculatory delivery of lipolytic hormones. Administration: consume 30 to 45 minutes before intended sleep onset. Rationale: allows renal clearance of excess fluid, prevents nocturne-induced arousals, and ensures peak apigenin plasma levels coincide with first SWS phase. It also reduces postprandial glycemic excursions by inhibiting activity in the proximal small intestine and enhancing peripheral glucose uptake through upregulation of GLUT4 transporters and skeletal muscle. Lemon juice and apple cider vinegar. Metabolic modulation: pectin forms a viscous gel in the gut lumen, further slowing carbohydrate absorption, while probiotic strains can transiently colonize the colon, promoting short-chain fatty acid production that supports colonic health and systemic energy homeostasis. Lemon juice and apple cider vinegar serve as complementary nutraceutical agents to prime metabolic pathways and regulate glycemic control, thereby enhancing nocturnal citric acid and vitamin C in lemon juice. Metabolic enzyme activation. Citric acid enters the Krebs cycle transiently, inhibiting phosphofructokinase 1 and glycolysis and shifting substrate utilization toward beta-oxidation of free fatty acids, antioxidant and collagen support. Ascorbic acid at approximately 5 to 6 milligrams per serving acts as a cofactor for prolyl and lysyl hepatoprotective detoxification. Citric acid enhances phase 2 conjugation reactions in the liver, facilitating elimination of lipophilic toxins that can impair mitochondrial function and metabolic efficiency. Acetic acid in apple cider vinegar. Appetite suppression and glycemic lowering. Acetic acid delays gastric emptying by modulating gastric motility via smooth muscle relaxation. Enzymatic enhancement and microbiome support. The mother contains raw pectin, amino acids, and live acetic acid bacteria. Lipid oxidation and hormone sensitivity. Studies indicate that nightly ACV ingestion can increase fasting adiponectin levels, a hormone that enhances hepatic fatty acid oxidation and reduces inflammatory cytokine production. Combined mechanisms and chronopharmacology. Synergistic pH shifts. The combined low pH of lemon and ACV may transiently influence gastric acid secretion, improving protein digestion and the release of appetite-regulating peptides, which can reduce nocturnal hunger pangs. Timing for maximal effect. Administering this mixture 30 to 45 minutes before sleep aligns with peak plasmacetic acid concentrations at approximately 60 minutes post, coinciding with the late REM phase, when growth hormone secretion and lipid mobilization peak. Administration notes. Dilution: mix both agents into the chamomile infusion after it cools to less than 40 degrees Celsius to preserve volatile phytoactives and avoid acid-induced mucosal irritation. Protective measures. Use a straw to minimize enamel exposure. Rinse mouth with water post-consumption. By leveraging these combined citric and acetic acid pathways, alongside the protocol aims to shift nocturnal energy metabolism toward sustained adipose utilization, reduce hunger signals, and facilitate hepatic clearance processes. Cinnamon and honey, antioxidant support and sleep hormone regulation. In this segment, we explore how cinnamon and honey synergize to augment antioxidant defenses, modulate glycemic stability, and enhance endogenous sleep hormone production, key factors in sustained nocturnal lipolysis and metabolic health. Cinnamon, polyphenol-rich profile. Cinnamon contains procyanidine type A polymers and which exhibits strong free radical scavenging activity. These polyphenols inhibit NADPH, oxidase-mediated reactive oxygen species generation in adipose, protecting mitochondrial membranes and preserving beta oxidation efficiency. Clinical trials demonstrate that 1 gram per day of cinnamon can reduce fasting plasma glucose by up to 18%. And hemoglobin A1C by 0.5% over 12 weeks. When timed at night, help stabilize overnight glycemia and prevent counterregulatory cortisol surges that impair glycemic modulation. Cinnamaldehyd enhances insulin receptor kinase activity and promotes GLUT for translocation in muscle cells. Lipid mobilization. Animal models indicate that dietary cinnamon increases expression of adiponectin and peroxisome proliferator activated receptor gamma in adipose tissue, signaling enhanced fatty acid administration considerations. Because cinnamaldehyd is poorly water-soluble, microdispersion into the cooled tea vinegar mixture with vigorous stirring for 30 seconds helps achieve maximal particulate suspension without degrading volatile constituents. Clinical data show that 1 teaspoon of raw honey before sleep can raise nocturnal melatonin levels by approximately 10 to 12%, improving sleep efficiency and reducing sleep onset latency by 15 minutes on average. A healthy gut flora produces short-chain fatty acids that can influence central appetite regulation via vagal signaling. This two-step approach preserves honey's bioactives and improves patient adherence. Raw honey, the combined polyphenols from cinnamon and honey. S-flavonoids work in concert to lower systemic oxidative stress markers, which can otherwise blunt hormone-sensitive lipase activity. Establish a gut environment conducive to short-chain fatty acid production, which has been linked to enhanced peripheral fat oxidation, osmoprotective and humectant function. Honey's oligosaccharide fraction draws trace moisture into the gut lumen, supporting mucosal hydration and facilitating nutrient absorption without spiking glycemiates. Glycemic index ranges from 35 to 55 depending on floral source. Melatonin precursor supply. Honey contains trace levels of tryptophan and glutamic acid, which serve as precursors for serotonin and melatonin synthesis in the pineal gland. Antimicrobial and prebiotic effects. The hydrogen peroxide and defensin-1 in raw honey exert antibacterial action, supporting gut microbiota balance. Taste and compliance. To mitigate bitterness from the tea vinegar cinnamon blend, either add honey to the warm beverage to ensure dissolution or consume immediately after through a spoon if the drink is cold. Integrated mechanisms. Antioxidant cascade. Hormone and enzyme synergy. Stabilized overnight blood glucose via cinnamon reduces nocturnal cortisol peaks, while honey-driven melatonin increases support growth hormone-mediated microbiome and metabolic health. Honey's prebiotic effects in ACV's probiotic constituents, consumption protocol, safety measures, and outcome monitoring. To maximize therapeutic benefit while ensuring patient safety, follow this detailed administration and monitoring plan. Consumption protocol sequential. Mixing and temperature control. Step 1. After chamomile infusion, add lemon juice and apple cider vinegar. Stir gently for 20s. Step 2. Incorporate cinnamon with vigorous 30s mixing to achieve Step 3. If drinking warm, wait until mixture cools to is less than or equal to 40 degrees Celsius. Before adding raw honey directly, ensuring full if cold, set aside the honey for separate ingestion immediately post-beverage. Timing and dosage. Chamomile tea, 240 to 360 milliliters with included agents. Lemon juice, 10 milliliters. Apple cider vinegar, 15 milliliters with mother. Cinnamon, 0.5 to 1. TSP honey, 5 ml. Administration window, 30 to 45 minutes before intended sleep, onset to align peak plasma levels with first slow-wave sleep cycle and allow pre-sleep voiding. Delivery method. Straw use. Mandate sipping via straw to protect dental enamel from acidic exposure. Hydration balance. Encourage additional plain water intake. Post-beverage to facilitate mucosal clearance of residual acids. Safety measures. Gastrointestinal tolerance. Acid reflux mitigation. Avoid supine position for 30-minute post-consumption. Raise head of bed by 10 to 15 centimeters if prone to reflux. Renal considerations. Monitor for Adjust water intake if nocturnal voiding disrupts sleep more than once weekly. Allergy and sensitization, patch testing. Prior to first full dose, apply a small amount of diluted cinnamon-oni slurry on inner forearm. Observe for 24H. For tea tree allergy, caution. Although in Part 3, we did not include tea tree here, patients with multiple plant sensitivities should be advised to monitor for systemic allergic responses. Drug-nutrient interactions, antidiabetic agents. Cinnamon S, insulin-sensitizing effects may potentiate hypoglycemia when co-administered with SMBG checks before and after initial doses. Anticoagulants. HADOS, vitamin C can interfere with warfarin metabolism. Monitor INR. If patient is on outcome monitoring and evaluation subjective sleep metrics by adhering to the specified protocol. Safety measures and monitoring schedule. Patients can expect incremental improvements in sleep quality and modest reductions in visceral fat over 8 to 12 weeks. Sleep diary. Record sleep onset, latency, number of awakenings, and perceived sleep quality each morning for 2 weeks. Validated scales. Utilize the Pittsburgh Sleep Quality Index at baseline in week 4 to quantify improvement. Metabolic and anthropometric assessment weight and circumference. Measure body weight and waist circumference. Weekly expect modest reductions. Over 4 weeks, fasting labs. At baseline in 8 weeks, assess fasting glucose, insulin, HbA1c, lipid profile, and adiponectin levels to validate glycemic and lipid improvements. Adverse events surveillance weekly check-in, telehealth or in-office, visit to assess GI comfort, oral health, and any dermatologic reactions. Serious reactions. Discontinue protocol if patient experiences persistent dyspepsia, significant hypoglycemia, unresponsive to dietary adjustments, or allergic dermatitis. Conclusion: this integrative nighttime regimen employs evidence-based botanicals and nutraceuticals to enhance sleep architecture, stabilize glycemia, and accelerate adipose oxidation.